organisations at their hospitals which are away from the front line.
We've got some slides, actually, David, that we were going to show as well. Firstly, this is a slide of a little boy that you worked with.
Well, this epitomises, it's not a very pretty picture, I can assure you, but it's epitomises what it is like to be as a war surgeon. So this little boy was in Aleppo 2014, a barrel bomb attack. He was about 4 or 5 brought in. He was going to lose his leg. Now, in a war zone, you can easily make a decision if you don't have the experience to just amputate. And of course, if you amputate a little boy's leg like that, the femur is going to grow. It's going to grow through the wound. It's going to, he's going to get septic and so on and so forth. But if you have the skills to pass on to the other local surgeons, then you can make a huge difference. So the skills that I've learned of plastic surgery, orthopedic surgery, certainly for this case, pediatric surgery. And so in this case, what you see here is the little boy that's come in, and we've externally fixated his leg. We've put an external fixator for his orthopedic injuries. And we've taken a vein graft from one leg because he had no circulation to his foot. And we've revascularized his leg using the vein from his other leg to make it into an artery. And that's the other picture. And then, of course, you need to cover that with plastic surgery. And you go back to 40 years with Mackindo and everything else. The surgeon that did lots of surgery in the Second World War. You use his techniques because you can't use the techniques now. You can't do free flaps. You have to use the old techniques. So you go the old techniques and learn years and years ago, which were good. And you cover that. And then you have a little boy that 3 months later is able to walk. And those are the skills that you need to pass on. You need to pass on, certainly for that case, orthopedics, vascular, plastics, and pediatrics.
So you're listing skills, okay, which of course you have in abundance. We're talking also about decision making, and which you are able to do when you're more informed, as you say. But what happens when that decision making is forced, when you have someone holding a gun to your head? You're not a stranger to that. That's happened to you a few times.
Yeah.
How do you keep yourself together in that situation? Or talk us through any other examples that you have.
Yeah, well, I suppose one example I can have is not in the hospital, but it's in. I was going to a checkpoint in the Congo, and again I was at a checkpoint, and the issue is at the fact that a man at the checkpoint had a gun. He was high on drugs. He was high on whiskey, everything else, and I could see him coming towards me, and I tried to put the window up like this, too late, and the gun came through and went onto my neck. And of course, then you're in a situation whereby, what do you do here? What can you do? And you're not in the situation whereby, it's not like Hollywood, where you open the door, bang, like this, and you bash him on the head. It doesn't work like that. You go into this sort of catatonic state of apoplexy, and you sit there and you realize that, this could be the end. So you work out mechanisms in your head to say, okay, how am I going to get around this fact? And luckily, at the time, there was the car had a guy in the back who could speak his language, and so he spoke to him, and I gave him my wallet, I gave him my phone, I gave him everything he ever wanted to let us free. But it's those situations whereby you are in a state of total and utter panic and anxiety. But you just have to sit there, and you just have to really feel that you can get over this.
You talk about radiating serenity in your book.
Yes, you just have to radiate some sort of serenity, both to who's in the car with you, who's next to you, and the driver actually in that car ran off. So there was just 3 of us left in the car, and I had to shimmy over and drive the car, which was very difficult.
So, wow. I mean, one of the things that you do as well, David, especially at the beginning, is you go find yourself in an environment where you weren't known, people hadn't worked with you, they don't know your skill set, and you're coming in, you're trying to get people to trust you to make big decisions. How did you go about that?
So again, when you do go to a war zone, or you go to a place where you go to a hospital, everybody looks at you as if you're a stranger. What are you doing here? Are you a spy? Are you do you have the skills to do the job? And what you do is you just go into the operating theatre, and you just stand there, and you just assist, and you just basically become friends, and you don't do anything. And if things are going slightly wrong, then you'll say, do you think I can just show you something here? And you get the scissors and you get the knife and you said, you know, I would do this with your, why don't you just do that? And they go, oh. And then all of a sudden you build confidence, and you build confidence slowly, slowly but surely. And then when you have the confidence, then they realise that you are their teacher and that you can teach them things which are going to significantly revolutionise their life. There was a picture just up now of when I was in Aleppo, and when we arrived there in 2013, they had an 80% death rate. All the senior surgeons had left, so you got this young group of surgeons that were dealing with the most dreadful of casualties. And so doing the teaching and doing the training, we got down to 3 weeks. We had no deaths at all in that period of time. And that was 10 to 14 gunshot wounds a day. It was quite dramatic how you can, with care and attention, get through.
And create the right environment for people to be able to...
And that picture there is, there's a guy there holding a gun who's the most craziest man I ever met in the world. And he would take us around in an ambulance. And so at the time, because Aleppo at the time was, there were few hospitals and they all needed training. So if they had a case that needed somebody to come and show them how to do it, then that guy there was the ambulance driver, Abu Abdo, and he would sit in ambulance and we'd be driving around all these hospitals showing. And even at night time, he would drive without any lights on because it was so dangerous to drive, because there were planes in the air trying to shoot cars that had lights on. So we would drive around completely in the dark. It was a wacko experience.
Amazing, to say the least. And there's a story about Aisha. Is that the right? Could you tell us about this story?
Yes, so in Gaza 2014, I was in a situation whereby a little girl had come in and she was on the operating table, and I was, because I'd done a lot of paediatrics, and I'm sorry about this picture, it is a difficult picture to look at, but this is what you see in a war zone, this is what you actually will see. And this little girl came in, she was 7, and she had evisceration of the bowel. You can see her bowels hanging out from a fragmentation wound, and the fragmentation wound's gone through the bladder, colon, spleen and stomach, and also gone through her arm, and if you look at her, she's dying. And I went in and I prepped her up to operate, and a man came into the operating theatre and said, David, we have to go now because the hospital's going to get bombed any moment. And so what decision do you make then? You're in the operating theatre, you've got this little girl in front of you who's dying in front of you, and somebody comes in and says, David, you've got to leave, you've got to go. And of course, I put it to anybody in this audience really, what would you do in that situation? If you had the skills to operate, if you had the skills to save her, would you save yourself for another day, which is quite a good thing to think about, or would you stay with her and realise that you know, she is going to die if you don't do something? Do you stay and operate, or do you leave? And I could not leave her. I just felt that, you know, why should I be bullied? Why should I be told what to do by some person who's sitting in some plane upstairs, who's flying around and pulling a button and going to blow me up? Why should I be at his beck and call? And these things were going through my mind at the time. And it again, it wasn't being brave. It was just that, how can I leave a little girl like that to die? So anyway, so I stayed there with her, and I asked the anaesthetist who put a tube down and was ventilated, you can go if you want. And he said, no, I'll stay with you. So the two of us just stayed, and as I was prepped her up and as I opened the tummy up, I was just waiting for it to happen. But it never happened. And there she was with me about 3 days later. I
wonder, when I hear you speak, if someone had said to you, like you're asking us, would you stay, would you go? Do you know the answer? Would you have known the answer of yourself before this situation?
I don't think you can ever.
No.
I don't think you can ever know the answer. You have to be in the situation whereby you know it is so profound that you will lose your life if you stay there. Will you lose? You know, would you do it?
Yeah. I think people can often underestimate what they're capable of, though.
Absolutely.
And if someone had asked you that, you would have maybe said, no, I don't think so. Until you're in that moment, you don't know.
You don't know.
But these extraordinary conundrums that you're finding yourself in, they're not normal. They're not average. do you keep seeking more? No, seeking is the wrong word. Do you keep finding yourself in more and more of these? Are you going back and volunteering more and more?
Yes, I mean, I'm off to the Yemen very shortly, and I was in Cameroon, and I was in Kenyan-Somali border recently as well. I mean, I'm teaching people how to operate now, and I'm teaching people on their cases how to do their surgery. So it's leaving a legacy, really, of that. But it's a matter of, you know, just we all have it inside us. And the other speakers that I've heard this morning, which I'm just so amazed at, we all have it in us to do amazing things.
Things we don't know we can do.
That we don't know we can do.
Remember when I was injured, I had a spinal injury, and someone said to me, if you'd been told that you were going to never walk again, what would you have done? And I remember thinking, I wonder what I would have done. I don't know if I would have wanted to live my life. You don't know until you know.
Exactly.
But what other advice might you give us? I'm going to keep pushing you.
There's another picture there which I was going to stimulate me to say something.
Another picture? The picture we just had?
Another one after that, I think. There was one after that.
The group picture?
Oh, okay. This is teaching surgeons in the Kenyan-Somali border with our instruments, and these are a load of surgeons who I'd spoken to and taught in Yemen at the start of this year. It's a wonderful thing to give back things to people, there's no doubt about it, and it's, you know, I think the social media we have now, WhatsApp and everything else, is a great thing to keep making big families of people, and we all keep in contact with everybody now. I just think.
That's a way to put it, making families.
Yeah, it's like a global family we're trying to create anyway, and I just think that you know, it's just, I don't know what to say really. I think it's a great thing to be able to, if you've got a skill and you can use it, then why not use it to the full extent of what you can
Fulfill
do?
your potential. Is that what you mean?
Fulfill your potential.
Okay.
Yeah, it's very easy to, you know, a lot of my colleagues will sit and say, well, I'll never do that date. But the problem is that there's a whole world out there that you can change significantly by just, you know, as one of the speakers said, just go and do it. Just wake up and go and do it.
Yeah. And it's interesting you speak, we've heard earlier from some people talking about just being yourself, and that will be enough. But you're also talking about learning skills to take you forward, whatever it takes.
You have to be the right person. You have to be the person that is able to give those skills over. You have to have the right temperament. You have to have the right personality. You have to have all these skills. I mean, on Monday night, I was just cycling back from St Mary's, and I got called and said, "Is that Dr. Nott?" I said, "Yes." He said, "You need to come to the Portland hospital now. Are you a vascular surgeon?" "Yeah, you need to come now." Oh. So I just cycle there. And I got to the Portland hospital, and there was a lady on the operating table who, again, was dying. She was exsanguinating from they could not get down to a bleeding blood vessel in the pelvis. And I used a technique which I'd learned from my war zones, which was taking a piece of the lining of the abdomen, and you create these little things by putting in stitches, and you create it like a pledget, so that when you put your stitch down and you stitch the vein which is hosing blood out, then and you use your pledgeted stitch, which has this like square on it, you can tamponade, you can put these things together and stop the bleeding. When I got in there, they'd had 14 units of blood. There were 4 surgeons there. Their blood pressure was really low. And I said, "Okay, give me a pair of scissors, please." Calm, took the piece, put the square, and put the stitch in the square, and went, and it stopped. And they went, "Wow." And I would never have learnt that had I not been to war zones.
No.
And so the skills
So put yourself into the risk.
Put yourself into the risk.
You'll grow out there.
Yeah.
Amazing. Unfortunately, we don't have time for questions. Are you going to be around? I mean, you're going to get bombarded if you are. Sorry. I'm just... David Nott, thank you. Thanks, David.